Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at NYU Grossman School of Medicine. I had a case a couple years ago in which I found myself completely at odds with the person complaining. A daughter came to me and said, look, my dad is in a nursing home and he's just there for care that he needs, but he's mentally competent. He's enjoying watching television, playing games, plays bridge, does many things. But the nursing home is letting him have a romantic relationship with a woman who's also in the nursing home. And I think you, ethicists, should both intervene and try to stop that and write more about the immorality of facilities like nursing homes or other long-term care settings permitting romance or sexual relations to take place. That case, I was reminded of it because a report recently appeared that sexually transmitted diseases are on the rise among the elderly, both in nursing homes and in other settings. And this obviously is linked up to another technological advance, the erectile dysfunction drugs. I'm sure there are many men who at one point in their lives in history could not engage in sexual activity due to impotence. But we have found a treatment for erectile dysfunction. Loads and loads of men are using it, and we forget some of them are going to be elderly and older. The rate of impotence goes up, completely associated directly with aging. And if you're in a nursing home or home care or wherever you are, you may find yourself able to engage in sex in a way that your dad or your granddad may not have been. We also know, and I found this out when I was tracking sales of erectile dysfunction drugs, that some of these older men are going to visit prostitutes. And that's another route, unsafe sex, for sexual diseases to be spreading into various older communities. Well, I think morally, every individual who is competent and wishes to engage in a romantic or sexual relationship, they should be able to do so. If they're within a marriage and they want to resume sexual activity because they get better or they can use drugs, well, that's great. If they're single and they're just living with others and they form a interesting romantic relationship, why shouldn't they be allowed to engage in sex? It is not only something that I didn't agree with the complaining daughter about, I think some of these facilities should make more rooms for privacy, more opportunity for intimacy. It's not like we should tell granddad that he's living in a college dorm and try to make sure that his roommate doesn't come in if he's going to have over his girlfriend. We could do better, and we ought to do better. We ought to make sexuality and romance part of the possibility of enjoying your older years, if that's what you wish to do. So are there ethical issues? Well, sure. Obviously, we should start to remember, if we have older patients, to talk to them about sexually transmitted diseases as part of a discussion of their sex life. Shouldn't presume they're not doing something. We should presume that they might be, and then remind them about safe sex, particularly if they're going to use third parties like prostitutes. Competency becomes important. It's one thing to have a mutual agreed upon romantic relationship. It's another thing if somebody's taking advantage of someone who's got Alzheimer's or a severe mental dysfunction and they're not consenting. How do we determine that and how do we manage that? I think people who are incompetent need to be protected from sexual advances unless, they've got a relative or someone who says they can engage if they enjoy it, if it brings them pleasure, fine. But I wouldn't just have people who are vulnerable exploited or acting in a predatory way toward others. And as I said, we need to rethink the design of where older people are living, whether it's assisted living or nursing home living or wherever, just to give them the opportunity to have a full life, as any individual would have, no matter once they're past the age of majority, about who they want to have romance with and what they want to do in terms of how far that intimacy goes. So sadly, I didn't agree with a daughter who came to me and said, stop it. I wouldn't stop it, nor would I publish against it. There are risks, and we ought to be aware, exploiting vulnerable people if they can't consent, the danger of transmission of disease, as would be true in any group that might do high-risk behavior, maybe even injury if someone is frail and can't really physically sustain sexual intimacy because they're just too frail to do it, and making sure that we address the issue of sexuality with patients to make sure they know what's going on, what risks there are, what rights they have, and so on. So at the end of the day, I'm not in the camp that says just say no when it comes to sex among the elderly. I'm Art Caplan. I'm at the Division of Medical Ethics at the NYU Grossman School of Medicine. Thanks for watching.